video about. Again, it's more of an educational video because we both think it's super important to discuss it. So she has a condition called scleroderma, all right? And it's a connective tissue autoimmune disorder that affects the skin, the muscles, the vessels, internal organs. It kind of affects everything, okay? So from our standpoint, from a podiatry standpoint, where we see it, and you can see down here for the feet, you can see the skin is super tight, all right? So she'll develop these little wounds. She's got one here. She's got one at the tip of the toe. This was actually black about 6 months ago, all right? She's got ones on the heels. The problem with the wounds is it's secondary to her circulation. She doesn't have good circulation, so we can't per se cut, all right? She also has some ingrown nails here that we actually cut back. Again, we can't, nor is it recommended to be aggressive with it by either cutting the ingrowns out or the skin because she won't heal it if it opens up. So there's also a secondary aspect of scleroderma. It's called CREST syndrome. CREST stands for calcinosis Raynaud's, which is where the skin, or excuse me, the circulation to the toes alters from red to blue to white, and that's going to be the impairment of the circulation. You get esophageal dysmotility, so swallowing issues. What am I on? S. S is sclerodactyly. So that's going to be what you see with the toes, and we're going to pan to our hands here in a second. You get really tightness with the skin and of the tissue of the fingers and the toes. And the last one is telangiectasia, which is basically like capillary or vascular issues. So I'm going to span to our hands now, and I'll let her chime in. So you can kind of get a really good idea here for the sclerodactyly of her fingers, all right? Obviously, she's had a couple ones that she's lost because just like her toes, she develops wounds, and then she has a difficult time healing them, all right? And obviously, they become real rigid, and the motility is not there either. So this is a better overall picture of the scleroderma versus her feet, but her feet certainly show signs of it. Do you have anything to add?
Yeah, so
You're the expert.
Do you want to be in the camera?
No, I don't need to be. So anyway, just to give you an idea of what Dr. Brennan is talking about, so I have calcinosis underneath my thumbs here. I don't know if you could see that. That's the first thing. And that's calcium deposits under the skin. Then Raynaud's is the color changes. As you can see, this finger here, the top of it, because of this contracture, this finger here is not getting an adequate circulation to the tip. So I'm having these color changes, which are actually very painful. And so that's part of the Raynaud's. And then I do have the reflux in my throat. It always feels like you can't swallow enough. And the sclerodactyl is what he spoke about, which is these fingers have actually been fused in a position that makes it easier for me to do things. But at one time, they were touching my palms of my hands. So the sclerodactyl can really cause problems with quality of life and what you can do with your hands. And then the telangios are actually these red dots. If you can see on my palm, they're all on my palm, these red dots here, and that's all vascular issues. They're finding that scleroderma is becoming not only a connective tissue disease, but there's also a large vascular portion of it that causes a lot of the side effects of the connective tissue hardening. So that's all I really wanted to say, but we can bring awareness to it. We have a foundation, sclerodermafoundation.org, where we educate and help people understand how they can take care of themselves better and roles for their caregivers. And a podiatrist is one of the doctors that's essential for scleroderma patients to have regular scheduled visits with, because we can't let any of this get really bad, because then we run into problems of not healing and we could lose a digit or a toe.
There you go. I mean, she said it. She's more expertise in it than I am at this point. I don't even know if that's a word, expertise.
It is today.
But yeah, we both thought it was important to discuss about it. It's not our normal ingrown nail videos or nail trimming videos, but it's the basis, and I think it's important. So if this message reaches somebody that has scleroderma, or a family or friend that has it, obviously know that there's a foundation and there's other people that are dealing with it. It may not be super common, but it's out there and it's available and there's help available. And like she said, it's important. It's a team approach, right? It's not just the podiatrist that's going to handle it. It's a whole slew of people that she sees on the regular to make sure that we're taking care of the best she can. And obviously, it takes a really strong-willed, great person to handle it. Not just anybody can take care of it, and she's evidence of that. So I hope you enjoyed. Again, different video, but I think it's worthwhile. It's both something we've talked about for a couple months now.
Sure.
On the video, right? So here it is to fruition. So Thanks for watching. If you have questions, leave them below. Check out, was it scleroderma.com?
Scleroderma.org.
Okay.
And Dr. Brennan's a great doctor.
Oh,
If you
thank
want
you.
to come over here and visit him, he does a great job. He's very sensitive and he has a lot of empathy.
Well, thank you. I'll give you the money later. But thank you as always for watching. I hope everybody enjoys. Like I said, leave questions below if you do have questions. I'll try to answer them the best of my ability. Like, subscribe, follow us on at Healthy Podiatry on Instagram. And what holiday's coming up next?
Easter.
Easter. Happy Easter if you